Good afternoon, colleagues. Good afternoon, good morning, or good evening, depending on where you are joining from. Uh, Dr. Bukhari, I don't know if you have a very significant number of people on the call for us to start, or we wait for like a minute or two.
We can wait 2 minutes. We can ask participants if they want to take the floor to say something, who is connected, if they can put in the chat from where they're connecting from.
Thank you very much. Thanks to Dr. Bukhari. Colleagues on the call from member states, from WHO country office and regional offices, please, you can actually introduce yourself in the chat to know where you are joining from before we start in the next 1 or 2 minutes. I think we have to start now. So, good day, colleagues. I want to use this opportunity to welcome you to this State Parties Information Session. And for this session, we are going to be looking at the State Parties Self-Assessment Annual Reporting Tool. Is the third edition of SPAR, which our colleagues on the call, they've really worked very hard to ensure that we have this the SPAR tool revised. Before now, well, the version that we have been using before is this version 2.0, that's the second edition of SPAR, which was launched in 2021, following the 2018 first edition. And this particular session is going to give us an opportunity to really understand the modifications, the new elements that we have in the third edition of this SPAR. Before we start, please continue to continue to introduce yourself into the chat, and so that we can know where you are joining from. Before we start, I would like to quickly take you through the WHO Code of Conduct before we start as per the agenda. WHO is committed to enabling events at which everyone can participate in an inclusive, respectful, and safe environment. WHO events are guided by the highest ethical and professional standards, and all participants are expected to behave with integrity and respect towards all participants attending or involved in any WHO event. For the housekeeping remarks, please note that we have interpretation in English, French, and Portuguese. And use the Q&A box for questions regarding the topics and presentations. Use the chat feature for general introductions and questions regarding IT or logistics. The chat may also be used by the presenters to share important links, contact information, and so forth. To take the floor, use the raise hand feature, as you can see on the screen. The moderator will invite you to make your contribution to talk. By participating in this meeting as a participant or a panelist, we take your attendance up as permission to record your contributions and share the recordings via various channels for learning purposes. A few days following this webinar, this session, please know that the PowerPoint presentations, the material that are used and recording will be shared with you. I've already shared some of them with you already in my previous mail. Regarding data use, we collect data for registration, participation, Q&A, comment, poll, and reactions, etc. Your individual data will be kept confidential. These data are used for MIE purposes only. Let me quickly walk you through the agenda so that to set the pace for this important briefing session. The first objective is to provide participants from WHO regional offices and countries and member states with a structured overview of the revised tool, highlighting key updates introduced to ensure alignment with the 2024 IHR amendments. Engage participants from member states in a systematic review of the draft tool, gather inputs on its structure, indicators, and usability, and identify areas requiring refinement before finalization. Build shared understanding among participants on how the revised SPAR will function as a monitoring and evaluation instrument, clarify timelines leading to the October 2026 launch, and outline next steps for integration into state parties reporting processes. So it's going to be launched in October. That means that for the 2026 reporting cycle, we are going to be using this particular tool, having with the hope that you would have made your input to this important tool. So this is the agenda for today's meeting. It's going to be focused because we are just going to touch on the element, the rationale for the review, for the revision, and of course those key elements that are now reflecting in the current tool. Opening remarks, of course, by our PAM, our emergency preparedness unit, and we are going to also have the introduction of the colleagues from the headquarters that have worked tirelessly to ensure that we have this tool at this time. Then the objectives, rationale, and highlights of revisions of third edition of this tool. Then they're also going to talk about the consultation process, the walkthrough of the consultation process that has led to the development of this draft tool. And please, you can keep your questions to the end. Just note your question. Some of you can also put in the chat box. I can assure you that all of them will be addressed. And we are going to end this session by discussing around the next steps and key expectations from us as member states. Thank you. On this note, I don't know if Dr. Chandler Dick is on the call. Dr. Dick, will give us a welcome opening remarks.
Hello, everybody, and
Thank
good
you.
afternoon. For those who are speaking French, I think bonjour. And for those who speaking the Portuguese, bom dia. And for those speaking Swahili, habari zenu. So I'm Dr. Dick Chamla, and I'm the program area manager for emergency preparedness. And I would like to welcome all of you in this important information session on third edition of State Party Annual Reporting. I recognize at the moment is really hard time for a lot of our member states. We have an explosion of Ebola outbreak in the DRC Congo and Uganda, and we are all hectic in trying to address it. We also have a number of our member states in which have been already started the processes of strengthening their readiness capacities. However, I really appreciate your dedication and time to come to attend this session here. Actually, in the past few years, from 2022, particularly in 2023, there had been critical global processes in which I think one has been completed, another one is still ongoing. And this process is international health regulation, in which it was adopted in 2024 in the World Health Assembly. And we had also a pandemic agreement in which the parent agreement, it was adopted in the World Health Assembly in 2025. And now we are in a process of completion of the PABS Annex, in which PABS stands for Pathogen Access and Benefit Sharing, in which it is critical to enable the entry into force of the pandemic agreement. All these changes and the new instruments in which we have, it requires some few adjustment and changes in our tools. in a way that one of the tools in which it required some few adjustment is a state party annual reporting tool in which all of you are aware. Our HQ there, Raj, I see, and Roland, between the call, have been really working hard under the guidance of another colleague, Stefan, and others. And I'm so grateful our member states in Africa that will have this orientation and information in which it will enable them to actually implement on these new changes. I'm glad for all our African member states. In the past 9 years, we have been achieved 100% SPAR submission. And our expectation is, despite introduction of the changes in this SPAR, we will be able to maintain our 100% reporting. Therefore, it's so critical. Today, all of you should participate. Please ask questions, ask clarifications in order to all be in the same page in order to enable us to complete this process. I would really like to encourage all of you to actually ask a question, provide a structured feedback in which it will enable us to either having more improvements in the tool or to make it so practical and relevant to all of us. I wouldn't want to take a lot of your time. It is only to wish you all the best in the meeting. And I really do hope it will be a constructive deliberations toward the end of the session. And I will have to say apologies in advance because we have a number actually of the meetings at the moment is happening related to Ebola, but I think I'm wishing you all the best and an excellent outcome. Yeah, merci à tous. Bye-bye.
Thank you so much, Dr. Dick. Thank you, Dr. Dick, for that great remarks. As you can see, for his statement, he said that your feedback is crucial because you want to improve this tool. So therefore, before we proceed, I just want to say emphatically that we really count on you to provide feedbacks into this tool so that we can finalize before the launch in October. So thank you so much. So the next item I have on the agenda is to invite our colleagues from HQ who have really put in a lot of efforts in drafting this SPAR 3.0 and with the supporting documents. So on this note, please let me invite Dr. Rajesh from the WHO headquarters to introduce the members of his team. Over to you, Dr. Raj.
Thank you very much, Dr. Kola. Thank you very much, Dr. Dick. It's nice to see you here. Apologies from Stefan, who's busy, as Dr. Dick said, with some of the EVD work that he's involved in here. But I'd just like to thank Roberta, who's online. And so Dr. Roberta Aggregetti is from the IHR Secretariat, and she's been intimately involved in the discussions that states parties to the IHR have had over the past many, many months in supporting the update and working closely with the Secretariat countries and thankfully for us with our team as well. So we had her advice and guidance in updating the states parties annual reporting, the 3rd edition. In addition to that, my dear colleague here, Roland, who brings not only the knowledge from the region, but also from the hub, who supported this work and moving this forward, and all the technical staff, the leads from the various technical areas here in headquarters that spend many hours with us in small rooms to articulate and update the indicators that we have there. So that's just a quick introduction. All three of us will speak during this meeting, so you'll see us at that point. If I could just, and my name is Raj. So I've worked with the SPAR, JE, NAPS, and all of the other acronyms that many of you are familiar with. So I'll just start with this. So this meeting, and thank you to our colleagues in AFRO that have organized this meeting. So this meeting is basically for the revision of the SPAR. So we're going to use this session to introduce the revision of the SPAR, and this is the third edition. For those of you who have been in the system long enough, you would know that we started off in 2009, 2010 with yes/no questionnaire, and then 7 years after that, we updated it based on the recommendations of the review committee, and then later on we updated it again in 2021 post-COVID, and now after the IHR amendments, this is the third update that we're doing to that. So the purpose of this meeting is we're not launching the IHR, but we're basically preparing the regions and the regional offices to lead the consultations and to get feedback from the states parties. So we've been working closely with the regional offices to make sure that this rollout is smooth, and we're there to support our member states as we move forward. Next slide, please.
Thank you so much for that introduction. So, can you see my slide?
Yes, sir.
Okay, please go ahead.
So, thank you again. So, it's a relatively brief agenda, I think. So we'll just go through some of the messages of what the key messages, why the revisions were required, and then the key changes. We'll highlight the key changes, what's there in the IHR and the IHR, then the implications to regional office and country office, and then the guidance on how countries can provide feedback to the regional offices. So, and the timelines and expectations. So we'll be getting feedback from all of the 6 regions, WHO regions. So we'd like to streamline how we get that feedback, so we can look at all of the comments that we get and appropriately respond to them. Next slide, please. So to start off with the first bullet point, basically, is that the SPAR 2026 and this third edition is an update. It's not a replacement. So we maintain the 5 maturity levels. We maintain the look and feel of this, but we had to update the SPAR based on the amendments. So these amendments are in force, and the SPAR needed to reflect the obligations, which includes the NIA and equity provisions, and the digital documents that are due to be reflected once the consultative process is finished. So we'd like to and the regional office is running this meeting, but this is more to let all of the member states and the states parties know that the regional offices are the critical link between us and the countries. So they will be leading the distribution of the draft and supporting the consultations as needed, and submitting the consolidated feedback to headquarters. So we've standardized some of our feedback forms so that all of the concerns and advice coming from technical partners and from countries can be captured in a standardized format, so we can get through reading all of them and coming back to the regional offices with what advice was taken and what was not taken and why. We have also developed guidance and training materials within this that we'll share. So for the considerations in updating the third edition, what we'd like to just mention, and this slide was developed based on the feedback that we had received from the first couple of meetings that we'd done with some of the other regions. Now with AFRO, we would have finished briefing all of the regions, and in a couple of the regions, we've also done the same with states parties. So if we start with the right side of this slide, if I may, so the alignment with the IHR amendments and to clarify the intent was what we looked at when we started updating the SPAR third edition. So as we looked at this, there were some changes that we had to make because of the amendments, but we also used that opportunity to clarify the linkages between the indicators and the IHR requirements. We also made sure that the wording and the ambiguity in the wording was reduced. So we reduced or removed all the qualifiers that were there in the previous SPAR second edition. And then we also, within the document, as you go through this whole document, you'll see that we strengthen the state party's relevance within that. And to avoid overly complex or duplicative capability assessments. It was interesting because we had the time to look at this tool with fresh eyes after the amendments, and it really helped in making the questionnaire a lot neater. So some of the other key points that I'll touch on here is that there is a clearer integration with the health systems and national structures. So you'll see that the updated indicators emphasize the health system strengthening within this tool. And one of the things that it wasn't our focus. We wanted, but what we'll do now, once we get feedback from countries, is to preserve the comparability through trend analysis. We know that many technical teams here, but also countries and various programs and other technical agencies use this data to help support countries and use this to track improvement or regression or stagnation in capacities. So where the indicators have evolved, we'll work closely with our regional colleagues and technical teams to make sure that we can continue to track trends over time and maintain that traceability between the old and new indicators. Okay, so on the left side of the slide, so the considerations that we had in this was that the tool has been updated 3 times, right? So one of this is that it is a living tool and it must continue to evolve. So this we think will happen at regularly routine intervals. So I think as we learn, it's good that the tool improves and then it gets better over time and it serves the purpose that it was meant to. And we also understand that many sometimes strategies, but some other work and planning is linked rigidly to the SPAR, and we think that the SPAR can inform planning, but it shouldn't be that rigidly anchored. Planning cannot be that rigidly anchored just to SPAR indicators. Now, the broader scope of the work that was done with all the people here, all the technical people here, was trying to align this more completely with the full IHR framework. And as you can tell from the first version of the SPAR, all the way up to now, it's improved over time. And one of the other key changes we've made is to move from performance scoring to capacity assessment. So we're trying to see what capacities exist in countries and to look at performance of the system, where we'd like to use other tools that we have in place, because we realized after 2 versions of this that it's really hard to look at the capacities that countries have and how they perform with a self-reporting questionnaire. So we had questions in a previous briefing that we had done, which was how do we measure performance? So what we're using this tool for is only to look at the capacities countries have. Performance can be measured through an after-action review or through a simulation exercise or other ways of looking at how the system performs and the multi-sectoral engagement that countries take in responding to a real or a simulated event. Next slide, please. So the why of the SPAR, I think I've touched on a few times, is that it was partially because it was legally, we had to update the SPAR based on the amendments. The second, and it had to reflect the new legal obligations that then came into effect. The second part of this was, while we had the opportunity to update the SPAR, we tried to make sure that the rest of the indicators were more aligned to the IHR. So a quick summary of the amended articles and annexes at the bottom of your slide. And some of the key elements that I'll come to again is the establishment of the NIA and the changes to Annex 1 and Annex 2, and the use of non-digital and digital health documents, but the consultative process of that is still ongoing. So we might expect changes in the future, but once the consultation process ends. Then the definition of the pandemic emergency and the commitment to equity and solidarity. So you may notice, if you've had time to look at this, that the gender indicator is now going to be folded within equity and solidarity, and won't stand out as a gender indicator within the SPAR. Next slide, please. Okay, so for those of you that are familiar, we started off with 2009-10 with 240-ish yes/no questions. So we evolved from that to 5 levels of gradation, where countries to tell us where across those 5 levels they sat with each of the technical areas, the 5 hazards, and the 4 hazards and points of entry. Now what we have in this new version is, as you'll see immediately, we've got 3 big sections. One is the expanded section on IHR-related domestic governance, where we have a lot of the legal components parked. The second one is the core capacity, which is core capacities, which is what you'll recognize from that we had in the previous questionnaire. So none of the core capacities have changed; they're all in there. And then a more expanded border health component. So with the indicator logic has been slightly updated as well. So the maturity levels and the scoring methodology have been a better reflective of how we want things to be done through policies at a lower level, but also more of a multi-sectoral and 3-level engagement as we get to higher up the tiers. This time around, we also have many more yes/no questions, and you'll see most of them exist in the points of entry section. And part of the reason for that is that there was critical data that needed to be where we needed to have the information, but we didn't need to know what level of maturity those were in. So we thought we'd make it easier and just ask yes/no questions whether something exists or it doesn't. And I think I touched on this. The tier differentiation is where we focus on governance from the national level, and as we look at the maturity levels, it then focuses more on the 3-level engagement and the multi-sectoral cooperation as we get to the higher level tiers. So there's a quick summary on the right side, which shows the new indicators that have been added. So I won't read through all of them, but those are the ones that'll stand out. And the last one, as I mentioned before, the consultations are still ongoing with digital and non-digital health certificates. So once that's done, then there might be an addition to the SPAR, but we'll keep everyone posted on that. Next slide, please. So this slide is just for. Go ahead.
You can speak more to the implications for this member state consultation. Yeah, thank you.
Sorry, did you want me to skip or talk about it?
I said you speak more to the implications for member state consultation. Yeah.
Sure. So and this again from discussing with other regions and with Afro colleagues as well. So some of the implications, I think, the questions that countries will come back with, and I think ones that we can answer, and Dr. Roberta is here as well to help clarify any of the questions, and we can continue to clarify this as we move forward over the next couple of weeks, is that the new legal and institutional requirements. So one is the national NIA. It has been introduced in the 2024 IHR amendments, and the designation of the establishment is expected before the SPAR in 2026. And as this questionnaire goes live in October 1, as Dr. Kola mentioned, the NIA would be accountable and responsible for the SPAR submission, replacing the national focal point. So the implications for regional support, for the regional offices, that there may be member states that request support from states parties for this transition from NFP to NIA, and clarifying what the internal coordination is, what the difference is, and what needs to be done to actually give the appropriate authority to the NIA. So the other key question that might come up is the comparability considerations when countries and technical partners are using indicators from the previous SPAR to compare country progress or compare maturity using the same indicators. So as I mentioned, I think in a previous slide, once in the beginning, was to say that what we'll do is once we finalize the SPAR, and as needed, we'll try to make sure that comparability can be done in a technical fashion that maintains as much as possible the comparability. But these may be questions that come up about certain indicators that have been used for a few years now. And it's the same with the last bullet point, because this might be more internal than external, where the GPW14, there are indicators in the GPW14 that are linked to the previous SPAR, and those will have to be aligned and updated for us. That's internal. And for the global commitments, we'll be doing the same. I think Stefan has got from our end, if there are questions from our partners and technical experts that use our indicators, we'll work with them to make sure that they can align, and there'll be less strain on countries. Next slide, please.
Go to slide 13.
We can
Go to the next slide.
Yeah.
Yeah.
You want to do this?
Yeah. So for this, we are looking to for feedback from state parties, our member states. We want them to review the entire document. Do not look only in your technical area, because you might miss out. The structure of the document has changed compared to previous versions. So some items from your technical area could be sitting in a different section in the tool. So read through the entire document and take note of questions and comments, which you would use the forms that COLA have sent out to you to submit your feedback. So check for clarity, feasibility, in the sense that are these things possible to actually implement? What we are measuring, is it possible to implement? Do we have alignment with your national systems, your national plans and structures? And most importantly, the aim of the restructuring, the revision, is to align with the amendments. So we should be looking at, we've made sure that we stated articles in the current 2024 amendments and link them to each of the sections, but also to each of the indicators. So that alignment we try to do, and we expect you to confirm or comment if you are not agreeing with that. So that feedback is structured. That's why we provided a template, so it's easier for our colleagues in the regional office to compile from all 47 countries and other stakeholders in the region, in Afro, and give us one document which represents the feedback from the region. And then if there are any country-specific or regional considerations, we'll also like to know about those, so that we take that into consideration when we're finalizing the review. And then if there's any other specifications that you need from us as well, anything that is HQ related, we should be able to provide that. Once again, read through the document and then use the feedback template that has been provided by Afro, so that your comments and feedback will be collected systematically and reviewed. Next slide, please. So this is what we will do when we get your document from regional offices. We're going to pull all of this, the 6 feedback forms from the 6 regions and go through the feedback. If we have further questions, we might come back to the regional office and see if we need any discussions. If something is very pertinent and we find it challenging to implement, we'll have an opportunity to discuss that with the regional office and see how to accommodate that, either in the SPAR or probably in the other assessment tools that we have in the IHR monitoring and evaluation framework. Finally, we'll have to upgrade the SPAR, and that will take us to the next slide, please. So the updating all of this process at the end, we want to have a new SPAR that we will use in 2026, October 1st. Mind you, with these amendments have been in 2024, they came into effect last September, but we couldn't use it in 2025. We couldn't upgrade our tool, so we have to use it to measure IHR implementation in 2026. So that's that timeline we have there. You have received, I was copied in an email that was sent out, so we should have received the tool, the draft tool, and the form, and the supporting documentation that you need. We hope that by the time we get to June 21, the regional offices would have been compiling and sending to us the feedback form from all the member states. So all the consultations with member states going from May, we started in May, this process. We are doing this specific orientation for Afro now for circumstantial, contextual reasons. But we are trusting that the timeline we have here by June 21, Afro would have received your feedback so that they have time to provide it to us, because from June 21, we will be doing consolidation from feedback of the feedback we've received from all the regions and other partners and our colleagues here at HQ as well. All the technical units here in HQ are also looking at the document, coming back to us. We consulted them the beginning of the process, but we're giving them an opportunity to see what that first consultation looks like and to revert with that. And we have a process of reviewing and finalization June 20 by June to June 30th. And in the month of July, we'll initiate processes for approval, clearance, translations, so that we can then move to the SPAR platform between August and September. That's where the bulk of the work is. Any delays in your feedback is going to impact the October 1st deadline, because there's a huge effort to create the new online tool, which you have all been using in submitting your SPAR for the past few years. So please, we know that we are all booked in so many ways, especially so now. Dr. Dick said it in his opening remarks with the various outbreaks, especially the current Ebola outbreak. But we trust that you would also give a little bit of your time to this very important process, which you all need. Next slide, please. So this slide, the next 2 slides actually concern our regional office colleagues. We've shown them how to consolidate the feedback using the forms here and share these documents with you. You have received that email. If you have any questions, you know how to get a hold of or any challenges actually using the documents and tools for these processes, please reach out to us through the regional office so that we can, if need be, get a call to clarify any issues. So thank you, Colin. Over to you.
Thank you very much, Roland, for that detailed presentation. On this note, before I call on Dr. Lat Anderson to moderate the question and answer session, I would just like to highlight some few points that that have been raised from the presentations. The first thing is about the evolution of this tool, which we all know that it was the recent modification was based on the recent events, IHR amendments of 2024. It came into force last year, September. And of course, we still maintain the 5 maturity levels with some structural changes, which you are going to see in the document that I've shared today. And what I would like to emphasize on is the timeline. Please, colleagues, we are still going to talk about this at the end of this session. It's important. That's one critical point I would like to resonate more on so that we look at these documents and we review. On this note, let me call on Dr. Lat Anderson to moderate the Q&A session. Over to you, Dr. Lat.
Thank you so much, Dr. Kola, for giving me the floor, and thank you to all the presenters, starting from Raj, Roland, and yourself, including Roberta. I guess you will also intervene to clarify some of the issues raised by the participants. So we have one question in the Q&A, which is from Dr. William Babazi from WHO Country Office, South Sudan, saying the IHR amendments were made in 2024. The pandemic treaty was adopted in May 2025. It has taken 1 year to generate a draft 3rd edition SPAR tool. Why are countries given 1 month to review and comment on the same tool? Question from William.
Roberta?
Yeah, why 1 month?
Sorry, there were 2 questions there. One was why it took so long to do the questionnaire, because it took since the amendments, which was in 2024, the pandemic treaty 2025, and now why countries have just 1 month to.
Okay. Regarding the first, the pandemic agreement that was adopted in 2025 is not yet into force, and it hasn't even started. The signature is not even open for signature because the PABS annex is still being negotiated. The only thing that this tool is try to secure is being consistent with the pandemic agreement when it will be coming into force, because the pandemic agreement is complementary, is intended to be complementary to the IHR and built on what the IHR stipulates. Second, as you know, we had SWHO, there was we went and we are still going through a huge financial crisis, hence we are very, very thin in human resources. And as Raj indicated earlier, embarking into the development of the tool implied reaching out through the entire house to be able to work on it. And then with we had the regional offices, Afro, Geneva as well. To some extent, we have been trying to engage with countries to have the sort of to get all the same understanding with respect to the amendment. We have shared material to that effect, and then we would, and because the amendments are coming from the countries, were negotiated by the countries, we would assume that you are very, very familiar with those amendments, and you are in a better, in the best possible position to see whether something in the revised draft SPAR is or is not adequate and since they came from the countries, those amendments. And yes, the time is relatively short, but national authorities are the best position to have a critical look at what is being proposed. Over.
Okay, thank you, Roberta. I hope William is clear. We have two additional questions from the Q&A. The first one is from Paul Ndala. Has basically two questions. Some technical areas from NAPS, which is the National Action Plan for Health Security, do not appear in the SPAR. What is the rationale for that? And the second question is, during the completion of SPAR, we used the PDF tool during our quarterly review for NAPS. So some technical leads suggested that the tool be in a way that it can be shared online, for instance, be in Word format, so that the technical leads can validate the areas online before the NFP can submit. I think that's just a comment. There is another question. Let me just read them from Amy. How the new SPAR edition will be aligned with the NAPS, which are yet to be developed based on the conducted JE 3rd edition.
Thank you,
Yes,
Dr.
Roberta?
Raj can start. Raj is starting. Yeah.
Okay.
Yeah. So maybe the questions 1 and 3. So our focus and for us and the urgency for us was to update the SPAR first, right? So that's what we did. So the States Parties Annual Reporting Tool has been updated. Now that it's been updated, once we get feedback and once we put this online, then we'll start looking at the other related tools, which will include the National Action Plan for Health Security and the Joint External Evaluation as well. So that's work that'll follow the work of the States Parties Annual Tool. I didn't quite understand the second question, but what we have, all countries, and I mean to Afro's credit and to the countries within the Afro region, for the past 5 years or more, we've had 100% submission from the region, and for the past 3 or 4 years, all countries have been submitting this online through the eSPAR platform. On the eSPAR platform, which we'll also update, but on the eSPAR platform, there is a possibility before hitting submit for the country to print out the form, get it validated, or get it signed off by senior management, and then the person that's submitting it will then hit submit. And there's 2 skip patterns on that, so you won't hit it by mistake. So if you hit it, it'll ask you whether you're sure you want to submit it formally to the WHO, and once that happens, it gets submitted. Roland here sees every submission that comes in. If there's an issue, email us, and then we can send it back, or we could do something else. So there's not a huge issue for submitting this. So the verification online, if you mean verification by the NFP or the other people in the country, it's completely possible.
I'm just going to add to that. So the submission of the SPAR online, we have for each country a certain number of people who can have access to the SPAR online. Those are the same people that the IHR Secretariat has granted access to. So the SPAR access is dependent on the IHR Secretariat list of NFPs that have been submitted, which is about 3 for each country, right? So that's the reason why not everybody in a technical area has access to the SPAR, because that's the restriction that is there, which means that not everybody can be responding to the SPAR questionnaire for their technical area at the same time, which is why we have an opportunity for people to use the offline version. And then those who have access are compiling feedback from all the sectors. That's how it is. Right now, if the Secretariat deems otherwise, then we can also use the decision from the Secretariat. Otherwise, only those that NFP contacts have access to the SPAR platform.
Okay, thank you, Roland and Raj. There is another question from Fikadu asking, what is the relevance of question DG 3.1 since all state parties have the obligation to designate or establish the National IHR Authority pursuant to Article 4 of the document?
Roberta, you want to take that?
Yes, it refers to whether or not is the question regarding whether or not the NIA is established. It applies.
Right.
Yes. Okay. Okay. The first reason is because not all states parties have not for all 197 state party the establishment of the NIA applies, because there are 12 of the 197 that have rejected the 2024 amendments introducing the NIA. Then for those state parties, that question cannot apply because that provision is not into force for them. I don't know if I've answered the question. And the yeah. Thank you. Over.
Thank you, Roberta. I hope Fikadu is clear. So the next one is from Polycarp Ndayi Ikeza, saying it's in French. Let me try and translate. How will the third edition of SPAR strengthen alignments between national capacity assessments and the operational requirement of IHR, including for decision-making at national, strategic decision-making at national level? I hope it's clear.
Oui, merci Polycarp. Dans la présentation, on a fait allusion au fait que dans la révision de cette troisième édition, on a fait un lien direct entre les articles du RSI et le questionnaire. Donc, pour chaque section, chaque indicateur, chaque sous-question, nous avons fait un lien dans l'introduction à tous les articles du RSI. Ça veut dire qu'à chaque fois que vous répondez au questionnaire, vous savez exactement à quel article cette question est liée par rapport au RSI, surtout les amendements qui sont entrés en vigueur, les amendements de 2024 qui sont entrés en vigueur. Donc, c'est ça le lien. Mais nous avons aussi, en tenant compte de ça, nous aurons l'opportunité après, nous avons reçu les feedbacks de chaque région. S'il y a des éléments essentiels, mais pas directement liés au RSI, essentiels pour la sécurité sanitaire, bien sûr, mais pas directement liés au RSI, nous aurons l'opportunité de revoir l'outil d'auto-évaluation, d'évaluation externe conjointe, qui sert aussi de plateforme, ou bien les exercices de simulation ou les revues après action. Nous pouvons intégrer ces aspects-là dans ces autres outils que nous utilisons pour évaluer le système de sécurité sanitaire dans chaque pays. Merci.
Merci, Roland. Thank you. Another question from Godfrey Boyer. It says, time for member state is very short. SPAR tool filling involve many sectors in government and validation. We have ongoing Ebola outbreak in DRC and Uganda in our region. Don't you think that diverting us to focus on SPAR review will be diversionary?
Yes, I'm going to attempt here. So we understand that there's a big Ebola outbreak happening in Afro. You might not be aware, but there are also other countries, other regions are providing feedback at this same period. Remember, one of the first questions here was why it has taken so long, and the amendments went into effect in September, there were still reservations, as Roberta has explained, and the challenges that we're facing as an organization to come up with this draft with the limited resources, financial and human. So yes, we have an obligation to assess the implementation of the IHR. Should we stop doing that because we have Ebola? That's a challenging question, and I don't have a direct answer, but we hope that we can all find time to support this exercise. Remember, it is not filling the form that is happening now. It is reading the draft tool, and obtaining feedback that will contribute to implementing the new, to assessing the implementations of the IHR in its 2024 amended version. Thank you. Over.
Dr. Lat, can I say something?
Yes, Kola.
Well, thank you very much. Just to say that we all need to sacrifice at this point. We are aware of the fact that there's an ongoing Ebola outbreak, and everybody is busy trying to support different areas of preparedness and response. And again, this tool, I believe that most of us are familiar with this tool. It's not a new tool. It's just some modifications that have been made to this tool. And there are different sessions, like when Dr. Raj and Roland, when they were both presenting, there are different sessions that have been highlighted in this tool based on the current, based on the 2024 amendments to IHR. We just have to encourage you to, as National IHR focal points in your respective countries, to share this with your colleagues within your network in your countries, to look at their different areas to see whether there are changes. Of course, they can still create time to read the entire document as a SPAR before, because the tool I shared about a few hours ago for the feedback survey, online survey form, you cannot fill it, or you cannot, because some of them, they require you to make comments about the way those questions have been framed and so on and so forth. So they look just to go through them, given that we know that you are very familiar with the context of IHR, provide the feedback. So we just encourage you, we appeal to you to just find that time within your network in your respective countries, so that we can get Africa as a region can also provide inputs, comments, so that by the time we have this document finalized, we can also have our comments reflected in this document. So we just encourage you to please bear with us and understand. We know the current situation. Thank you, Anuba.
Thank you, Kola. We are really sorry, colleagues. So we know the timing is not what we are expecting, but what if the situation is even worse next year or the year after? So it's just like what Roland said, it's an obligation. So we will need to try our best, like we usually do, to try and meet this deadline. There is, I think, two more questions. There are two more questions. The first one is, saying what were the relevance of question. Sorry, it's keep jumping. I think the person deleted the question, but there is one.
No, Anderson, sorry, let me jump in here. I answered the question. That's why.
You did, huh? Okay. Okay,
yes.
thank you.
But since we have to say it, I don't know if everybody was saying it. So WHO didn't decide that the NEA will become responsible for the SPAR. It was a decision that the WHO is enshrined in the 2024 amendments. It was not a decision. It was a long discussion. If I give Roberta time to speak on this, we might finish tomorrow. So just as take that, it was a decision made by the member states, and maybe it's part of why some other member states have reservations or not, but it's part of the amendments. Thank you.
And let me also add that we need to work closely with our NEA, whether you are NFP or NEA. I believe that some people on this call that serve the role of both NFP and NEAs on this call in some countries. I'm very aware of that. So, but the bottom line is that we need to work very closely together as a country. You are in the same country, and as Roland rightly mentioned, this was based on a decision during the WHO from member states. So we need to work together. We shouldn't see this as rivalry that no, I'm not going to cooperate with you. You still need to support them. They need to support you too. And I think it's something that we have to bear in mind. Thanks. Over to Dr. Lat.
Okay, the next is, I think is in Portuguese. I try to translate. If I'm not mistaken, from Baka Kamara, is requesting the presentations to be shared, the slide to be shared.
I shared already about 2 hours ago. I can also reshare, but that person can maybe drop his or email in the chat so that I can share with the person. I've already forwarded the presentation. It's the same presentation that we are making that I shared with all other supporting documents, including the online link to the feedback survey. So everything has been pushed to you. And the other materials I also share when you are reading through the documents, in case you need some clarity, there are materials on, apart from the PDF version of the SPAR 3.0 that I've shared, we have materials on frequently asked questions. There's also one that looks at the comparison between the second edition and third edition. So you can pick from that. And the methodology for the revision have been shared with you. But if that person can just drop your email on this on the chat, I will share a photo to you. Thank you, Anuba. And we also encourage the NFPs because you may have some other people from other sectors that you want to share these materials with. It's important for you to push to them these materials so that they can have all the relevant materials to guide their review of the SPAR 3.0. Over to you.
Thank you, Kola. Thank you, colleagues. I think there are no more questions in the, in the Q&A, unless there are colleagues still want to ask questions. You can raise your hands. Can give ourselves like 2 or 3 minutes before we close this session. Okay, I hope we're able to cover all the questions which were asked. So let me give back the floor to Kola for the next step.
Yes, just to quickly go through the next steps. I think we have about it's already 4 in Nairobi here. The first item on the screen is to distribute or disseminate draft SPAR 3.0 tool and feedback them to state parties and partners. These I've already done. If you're on this call and you didn't receive this document that I shared today, please you can reach out and let me know. So we've shared these tools with you, a lot of information in the supporting documents. So please, we know the time is short, so we urge you to kindly review these documents and provide your feedback through the online link provided. The second item, of course, is this meeting that we're having now. It's been convened already, and still the request about you reviewing these documents to provide structured feedback. So basically, what is expected from you? This was prepared based on the last session we had with the WHO country offices and regional office colleagues. So what we expect from you is to be mindful of the timeline. We know it's short, but please let's try our best to ensure that we create some time to review these documents and provide our feedback. We need to reflect our input from the region. So this is what we expect, and the deadline that we put there for submission is actually 12th of January, but we can still take till 13th to 14th of January so that we are able to harmonize or put together your comments. And from my side, we'll provide this feedback to the 8Q for harmonization from all the different regions within the WHO. So this is what is expected, but in case you have any question, please feel free to reach out. I'll be sending out a reminder to you maybe every other 3 days or 4 days, or every week. I can make it 3 days. Every 3 days is fine. Not to disturb you, but just to remind you to also give priority to this important activity, important area of our work. October is not far from here, so please let's prioritize this activity. Reach out to us if you have any question. Those are the next steps, really, is just to get the feedback from you as colleagues in the country. I think on these notes, I would like to hand over to our 8Q colleague to provide to give closing remarks. Anyone from the 8Q? Rajesh or Roland?
Before Raj provides the closing remark, Kola, I've seen in the chat a few people says they have not received and their emails are there. I don't know if you'll be able to capture this after the call. Maybe Bukaro will help us with those emails. There's a few people. Okay. So over to you.
Thank you very much for
that. Well, thank you all for your time. Thank you for this opportunity to provide direct orientation. As we've said, during this time, we remain very much available through our regional office colleagues to provide further clarification as needed. And if you run into any issues, colleagues in the regional offices, using the platform, the SharePoint site, please do not hesitate to do a quick call with us so that we can also provide that support. We remain open. We trust that we'll find time to do this very important work because we have to do it in spite of everything that is happening around us. And our leadership at all levels are also expecting us to carry on with this exercise. Be the leadership in government, which they expressed at the WHO that ended last week, and our leadership as WHO. So on both sides of the aisle, our leadership are expecting this exercise to be finished and rolled out come October 1st, reason why we place a lot of time and resources between now and October 1st for this exercise. Thank you very much and all the best.
Thank you. And bye from our side.
Thank you. Merci.
Thank you.
Thank you.
Bye-bye.
Thanks, Roberta.